Hello, everyone, and welcome to this new episode of AIVantAge series of podcasts on innovation in aging services. Specifically, this is All-One AIVantAge has been sort of established to raise awareness to available technology solutions and to help providers of aging services accelerate the adoption and the strategies to utilize the appropriate technologies and innovations out there. So today it's my great pleasure and honor to host Chris Deck, who is a physical therapist. He's a doctor of physical therapy with a master's and an MBA, and he is the rehab director at BlueStem PACE Program. And again, this is part of a series that I have launched around the PACE programs because I'm a big believer in the potential for PACE programs in serving underserved older adults with complex and multiple conditions, as it is unique in terms of combining multiple sort of funding sources, multiple payment models, and at the same time, alignment of incentives, allowing the providers to the leeway and the freedom to not only innovate and implement the right solutions, including technology solutions, but also reap the benefits and the savings, and you reuse it and utilize it to improve the quality of care and quality of life of their enrollees. So with that said, welcome, Chris, and thank you so much for accepting my invitation.
Oh, it's my pleasure. It's good to see you.
Thank you. So let's start by letting the audience know a little bit more about yourself, your background, and also a little bit more about BlueStem PACE, what it is and what kinds of services you deliver for older populations in Kansas.
Yeah, thank you. So my name is Chris Deck. I've been a PT for 30 years and was the executive director of a federally qualified health center in rural Alaska, so just north of Valdez by a couple of hours, and then left there to go to Wichita State, where I was a safety net clinic director, and then got a call out of nowhere to be part of a PACE organization. And that was 18 years ago, and realized that this really could change things. It's a whole different, I love your intro. You nailed it spot on. And PACE is its own healthcare system. And so I've been in 3 PACE organizations, all in the Midwest, and it's a wonderful model. Like you said, there's a lot of freedom. BlueStem PACE is unique among PACE organizations. We may be the most rural PACE in America. We've got 130 participants, give or take, stretched out over 7 or 8 counties in Kansas. And we just received some funding, so we're going to be expanding that even further. But it's a challenge, but it's also a lot of fun. It demands a lot of creativity and working within an interdisciplinary team. So yeah.
Absolutely. And by the way, I'm a fan of the state of Kansas and I have to applaud them and plug in, because I know that also they have a Medicaid waiver program that encourages the adoption of, again, gives more freedom and the adoption of technology and innovation to keep people at home. And I know a couple of providers that have applied for this waiver program and experimented with biometric remote patient monitoring and behavioral monitoring and AI-powered caregiving and so on and so forth.
Right.
So that's great. So you've been in multiple PACE programs. You've been you spent the vast majority of your career in healthcare. tell us what are some of the major trends that you see in healthcare, especially for older adults, and maybe more specifically in PACE programs.
Yeah, within PACE, within older adults, I would say one of the trends is the whole push for longevity, and that's many of your listeners and viewers will resonate with them. It seems like the longevity conversation is falling within socioeconomic lines, and those who with more resources will think about longevity, but it doesn't really reach people who are Medicare, Medicaid population, which would be more PACE participants for the most part. So that's definitely a trend, and I think that's going to continue to evolve. In the therapy space, a few things that are happening are there's some emerging exercise techniques like blood flow restriction, and that's something that we've done research on at Wichita State University, where I teach and I co-lead their research agenda or their research efforts. So blood flow restriction, BFR, is a way of getting stronger with less weight. That's an aspect. There is also dynamic neuromuscular stabilization, which is an approach to strengthening that basically follows the developmental pathway, and we use that with adults. And the last thing I would say, well, two things actually. One of them is there's a real push to exercise with intensity that, when I went to school 30 years ago, we were using the therapy exercise bands and stuff like that. And we're using those less, and that's a positive development. The last thing is that we're doing more with lactate testing, and Kansas just passed a law where PTs can start doing lactate testing, and that's something that we've innovated with. And so what lactate is good for is that it's a good measurement of intensity for exercise. So that's where the research is headed, is more intensity, more what we would call periodization, meaning more of a comprehensive approach to exercise.
Excellent. So now let's switch gears a little bit and talk about some of the innovative approaches that you're seeing being used in practice, especially innovations related to technology innovations. Sure. I'm an engineer, and I cannot not talk about technology and AI, especially in this day and age where we're seeing an explosion of AI-powered tools and so on and so forth. I would love to hear not only what you're seeing there, but also your perspective. Are you receptive? Because again, sometimes you find people who are diving headfirst with technology and AI. Others are sort of don't want to touch it with a 10-foot pole, and of course, neither are necessarily right. So sometimes we need to take things with a cautious approach about some of those innovations. So I'd love to hear from you.
Yeah. So there's three things that come to mind on that. With that, one of them is we do use some ambient LiDAR. I want to say it's LiDAR, where it's recording. It's not an image that it's recording, so it's not like it's de-identified data, and we're able to see if somebody has a change in terms of their habits while they're in their room or in their living space. That's one. Another one is that there's more development. There's been a lot of development from an AI perspective in terms of movement analysis, and and so that could be like looking at a timed up and go, or just the quality of movement, not just the speed of movement, but the quality. There's more that way. One thing that we've been working on is ambient AI in terms of listening into our conversations, and being able to take those conversations and record them into notes, whether that's a typical medical note, like what we would call a SOAP note, which stands for Subjective Objective Assessment Plan. That's what SOAP stands for. Anyway,
Yep.
recording it into a note like that, or even into just a general record there.
Electronic health record directly.
Correct. Yeah. And so I see that as, I think your other question was, is that beneficial? And American healthcare is unique in how complicated it is. And I think if there's any way to reduce barriers, we need and reduce any silos, I think that can be very helpful. And so I think I welcome any of those advancements. I think they're worth playing with and trying out and seeing how we can implement them.
So can you elaborate a little bit? So it seems that you're starting to identify some of the challenges, right? So can you elaborate a little bit more about those silos? What silos are you specifically referring to? Is it Medicare and Medicaid, since these are the two main funding sources? Is it the hospital and the PACE program? If the PACE program is not, some of the PACE programs are integrated or part of a hospital system, others are not. So I would love to hear your perspective.
Right, for sure. And so, and the answer is yes, right? So so to your point, on the Medicare Medicaid side, you're asking about specific funders. And there definitely are silos when it comes to the funding side. And it's not just government, which is Medicare and Medicaid, it's even private as well. But then the second part of your question really got at, hospitals, and you're talking about at that point, the providers of care. And, America, in America, we're blessed that we have so much innovation and so many opportunities and so many interventions that are available to us, but those are all housed within different clinics and different specialists. And so each one of those clinics or specialists, they have their own medical record. And those medical records don't speak with each other. They're optimized for their specific billing platforms.
And billing.
And so it becomes, it's one more hurdle to get over, and it's terribly, terribly difficult. And some people might even say that it's intentionally designed to be complicated. And I'm just, for background, I'm the reimbursement chair for the Kansas chapter of the American Physical Therapy Association. So I get calls and emails from folks saying, I don't know how to navigate this billing issue. And that happens pretty regularly. And it's just, again, sometimes it almost feels like it's by design. But those silos are legion. And what's nice, or the hope that I have when it comes to ambient AI, is that maybe it can be listening in on me. And I've got the program, maybe the specialist is using the same program. It can be listening in on that interaction with the patient. And then together we can be sharing. I don't have to share notes, reports so much with that person. So it kind of reduces that. And maybe there's a way to bridge that gap through AI. It's kind of my hope.
Yeah, absolutely. I totally agree. I think there is an opportunity for AI, especially when first, let me back up one step. First, you're absolutely right. Those are complicated by design. I wouldn't say by design, by their root of how they were created, right? Electronic health records specifically. Initially, they were sort of pushed by federal mandates, to document a certain way for each type of practice, and number two, to submit for billing electronically. Everything else was sort of slapped on, And while we advocated for interoperability, we advocated for the long-term post-acute care. Again, which was excluded from the healthcare incentives, number one, and from the initial interoperability and health information exchange sort of funding and effort and so on and so forth. So I hear you. And the other thing, or the consequence of that, of the lack of interoperability, is that there is lack of interactive, collaborative care planning, right? Where in real time, multiple care teams of different disciplines from these different silos are unable to not only see the full picture, but in real time collaborate and make sure that the right hand knows what the left hand is doing, as opposed to duplicating efforts, duplicating tests, and prescribing different things for the same sort of issue, right? So I totally agree. And at the same time, I wholeheartedly believe that there is an opportunity for AI, as you said, with ambient listening, with sort of parsing the different AHR records, or preferably the comprehensive EHR record through the HIEs, pulling the different separate pieces and collating them together and parsing them together, and giving specialty a different sort of what they need to know, and provide an opportunity for collaborative care planning as well. So that's
well stated. Perfect. Yep.
That would be a dream come true. That would be something that, but at the same time, also on the back end, once the care plan is done and the clinicians or the practitioners start implementing those plans, at the same time, sort of document and submit based on the rules and regulations for and the coding for the right coding for each specialty and each team member. But again, I totally agree that we need to overcome the interoperability barrier first between practices and between electronic health records.
The other thing I would add to what you just said, which was again spot on, is that in the context of PACE, one of the things that I challenge my staff to do is to think outside of their discipline. And so, like, if I have an OT or an occupational therapist, I'll say, I'm not worried about you being an OT. Like, you've got that. That's totally fine. But what I do need is I need you to think like a social worker. I need you to think like a dietitian, and I need you to think in a multidisciplinary way. And I think, to that point, I think AI can help with that. And so, and I see we see this trend already in therapy. There's a new thing out. You've heard of cognitive behavioral therapy, and all that stuff. Now there's cognitive functional therapy. And so, in other words, what that is it's the space where people who have chronic pain, PTs and OTs, are getting into this CFT now. So in other words, what is that? It's, in one way, you could characterize that as a clinician learning how to think a little bit outside of their discipline in a new way. And I think AI, in addition to everything else you said, I think AI can help with that in terms of bringing those other perspectives in and saying, have you considered whatever, so that whenever they're in front of their PCP, their primary care physician, they're at, maybe it's even prompting them to ask questions about socioeconomic or, family, whatever. Like, So.
Absolutely. So again, I think this is fascinating because, you and I and everyone is using Copilot and ChatGPT, and they're part of our daily life. And I think what you're saying, like, is bringing an idea in my mind that I always use when I use these tools. I ask it to act as if it was right? As if it
Assume
was a
yeah,
researcher,
yeah,
as if it's a dietitian,
right,
right?
right,
So
right,
when you set that mode, it focuses on that
right,
specific domain and gives
right,
you that perspective.
right.
Which again, if you're a PCP and ask it to give you an answer as a dietitian, again,
Sure.
that broadens your horizon
Yeah,
and gives you more opportunities to.
yeah,
So it's
absolutely.
fascinating. It's
Yeah,
fascinating. Again, there's a lot of opportunities. I think the
yeah,
sky is the limit, or
right,
maybe our imagination is
right.
is the limit.
Yeah, I
So
agree. I agree.
yep, yep, yep. Excellent. So what are some of the challenges that you face on a day-to-day basis at your
Hmm.
PACE program, especially given that it's rural and there are sort of the
Hmm.
distances and so on and so
Hmm.
forth? You mentioned that you use the LiDAR. I would
Hmm.
love to hear a little bit more about that program. What do you monitor remotely?
Yeah,
And if there is anything else that you have considered.
yeah. So we just stood that up, and it's maybe we went live 3 months ago, something like that. It's within this year, and I'm not. If we have had any, um, I'm not sure that it has signaled us to any changes yet.
Okay.
So I'm not sure that we've had any interventions based off of any flags that that's raised.
Okay.
It'll be interesting to, and again, that's not a critique of the system itself. It may be that it's coming. I just don't know. It just
Yeah, yeah,
takes.
yeah. Yeah.
Um,
It could be related to staff training. It could be related to staff sort of embracing it and integrating it into their daily workflow. It could be a number of things, but
right,
yeah,
right.
yeah, yeah.
So there's that. As far as the challenges that we face in rural Kansas, I don't know if this is causation or correlation, how it works, but we have a lot of falls. We also have a lot of mental health diagnoses. I would say over half of our population has a mental health diagnosis, and that can range from, I mean, anxiety to depression to borderline personality disorder to dementia, like anywhere in that spectrum, right? So
Right.
there's that. That tends to breed, it feels like, now this is a physical therapist talking, so I don't know that this is actually true, but that tends to breed polypharmacy, which is
Oh, yes.
its own animal. And
Animal.
so
Yeah.
um, I don't know if the bearing that those dynamics play in terms of falling. I think falling is particularly difficult, and it could be terrain related and in terms of just being in rural Kansas. I don't know. Um, but there are a lot of dynamics there. The But I wanted to go back to something you said in terms of staff training, and I think there's an element there that's worth noting is that just like within medical care, as from a clinical level, there's all the specialization at the staff level, whether it's front office or back office, there is almost like the specialization that has to occur when it comes to technology. The EHRs are not getting any more simple. And then you add in AI, or you add in LiDAR technology, or you add in whatever. You know, it's um, it's a little bit more than just using a spreadsheet, and not everybody feels comfortable using a spreadsheet. And so it's it almost feels like things are becoming more specialized that way in terms of not just the technology for sure, but even the interaction and how even non-clinicians interact with that technology. I don't know if you have any thoughts on that.
Yeah, I totally agree. And again, whether it's an EHR or anything else, they're always constantly being updated and we the sort of right they're in the cloud. The designer or the manufacturer or whatever you want to call it, the vendor pushes these updates, but we rarely see them offering a refresher training, right, on how these updates are going to change. Especially again, when it comes, maybe when they do push an AI tool or an AI powered functionality, I should say, maybe they sort of produce some light training or awareness videos and so on and so forth. But again, when I was at Leading Age, one of the things that we harped on is the importance of ingraining technology training and training a trainer, not necessarily just relying on the vendor for support all the time, and training more than one, and continuing to do refresher training, as again in partnership with the vendor, because it is, I totally agree, it's extremely important. And even for the patients and or residents, right? Sometimes they need to interact with the technology, and sometimes they come and the interface is looking slightly different. And so I want to go back to something you mentioned about the falls. Definitely polypharmacy is again, that's something that I'm gonna wear my previous life researcher hat. Polypharmacy plays a role in increasing the risk of falling. It actually, one of the things that I've done fairly recently is I developed a machine learning fall prediction so plug-in to the EHR that relies only on the EHR. And one of the most significant factors that the AI identified for fall risk is the diagnosis. And again, dementia is one of them. There is a high correlation between fall risk and dementia diagnosis, number one. But number two, also the polypharmacy, and we have identified, we used one of the top pharmacists gave us a list of the top sort of medications that are recommended to be avoided when someone is experiencing a fall. So I totally agree. I think these are definitely it's not a suspicion or correlation, or I think it is a causation, frankly, or at least a contributing factor. But again, falls, as we all know, are multifactorial. So there's the environment itself, the lighting, the vision, the throw rugs and thresholds and steps and lack of bars and grab bars and so on and so forth. So absolutely. So and that's, again, falls was one of the areas that I focused on and tried to create fall detection, fall prevention. But again, average walking velocity is also a good indicator of fall risk.
Absolutely, it's huge, and I don't know that our population really. I'm going to sound critical here. I'm not sure that they put the same weight of falling compared to other medical diagnoses. So I think if somebody, there's a lot of emotion that's kind of bound up in a cancer diagnosis, as opposed to a fall. Although, I don't have the stats in front of me right now, but if we were to be able to cure cancer, the amount of life extension that we would have on average, from what I think I've read before, is actually less than if we didn't have falls. And so, and you're probably in a better spot to comment on that, but falls it's a huge issue.
Absolutely. Absolutely.
And
A
we don't always
fall,
see. Yeah.
an injurious fall that results in a hip fracture
Right.
reduces life expectancy to less than a year.
Yeah.
1 year post
Yeah.
the injurious fall.
Right.
So I totally agree. It's one of the major
Right.
sort of diagnoses or events, I should say,
Right.
that costs the federal Medicare. I think the last time I looked, it was close to $200 billion a
Right.
year. Billion with a B.
With a B. Yeah.
Yep. Yep. So that's great. So if you had a magic wand, right? Whether it's technology, AI, or anything else, which one of the what challenge would you point it at to
Yeah.
improve the delivery, the access for older adults in general, but
Yeah.
maybe more specifically at the PACE population?
Yeah. I get to choose one, huh?
You can choose up to three. Let me give you some leeway.
I think no, that's good. I think early detection is really important, and being able to get ahead of an issue before it becomes a problem is huge. And at Wichita State University, we've done some work on that in terms of identifying what are those early signals. So I think number one, getting ahead of an issue is huge.
Yep.
I think another one is just reducing the barriers to care, and whether that's de-siloing, if that's a word, just ways that we can just reduce the friction and just being able to, once we realize that there's an issue, let's intervene as quickly as we can, completely as we can. And the third one would be, I think it's vital that we exercise with intensity. And I'm not sure that is a new concept for a lot of people, but it is so important. What we're finding is that as we hardwire our programs, as we engineer our programs, our exercise programs, to where it builds in a variety of exercises that people have to do with intensity, we're finding that our falls go down. And that not just falls, but our ED visits are going down as well. So I think exercise with intensity is a really big deal. So our skeletal muscles are our largest endocrine organs, and we need that regular pumping of. There's over 100 exerkines or hormones that our muscles release whenever we exercise, and our body just need that regular stimulation.
I could not agree more. I think we, generally speaking, we're not exercising enough, and I think key to successful aging is continuous and regular exercise,
Right.
especially sort of exercise with intensity.
Mm-hmm.
And it's well documented that it has a significant impact not only on falls and hospital and emergency department visits, mm-hmm. but also cognitive decline and the mental health. Actually,
absolutely,
we feel better and less depressed right. when we exercise, especially when we do it in a group setting. So.
Right. Right.
And it's key to successful aging, and I'm trying to do that myself.
Yeah.
I do karate and kendo twice a week.
Wow! Yeah.
And I swim, and I also, there is an exercise for the lazy. I don't know about your opinion about that, but I've heard that there's research, again preliminary research, that points that sitting in the hot tub for 20 to 30 minutes has an equivalent event to exercising intensely for 20 to 30 minutes. What do you think?
Oh, really?
That? Yep.
That's new to me, but it makes sense. For a while there, we've been looking at like cold therapy and immersion baths and things like that. And I think the research has has been more biased towards the more heat than cold. I'd have to look into that. I don't, but it does make sense. We do get a release of interleukin-6 with heat, so that would make sense, which is a major myokine. Yeah, that tracks. I love what you said. Oh, go ahead.
No, go ahead.
No, I love what you said about the whole with others and communally. And we had some research that I presented in Tokyo a year ago right now. And looking out from our Airbnb, we were just right outside of this plaza. And every morning there would just be this group of people, and they would just be doing their exercise together. And it's like, yeah, we could do better for sure.
Yep. Excellent. So let me ask you what goals or aspirations you might have for BlueStem PACE, the population that BlueStem PACE serves, or yourself over the next few years.
Yeah, I think I would love to see us continue to reduce our falls as much as possible. And I'd like for us to become more predictive of and so I'm working with an epidemiologist at Wichita State University and seeing if we can figure out like odds ratios and relative risk for various conditions. One of the things that's unique about PACE is that while we will put into buckets or hierarchical condition codes, or HCCs, various diagnoses. And so seeing if there's a link between various diagnostic buckets and falling or ED visits, I think that would be interesting. I think from an organizational standpoint, we received some funding recently where we can expand into rural Kansas. So this is like Southwest Kansas, where there's a lot of meat packing plants. There's agriculture related businesses out there, a few population hubs, but really not a lot that on their own would be a critical mass for a PACE organization. We're going to see if we can move the needle in terms of developing like an innovative PACE model out there, and see if we can move the needle in terms of reducing utilization. I think would be great. I'd love to see if that would be possible. So, yeah.
Excellent. Outstanding. I love your focus on predictive and becoming more proactive. And again, predictive is good, but again, if we're not taking that information and doing something about it, getting ahead of it, as you said, and especially again, I'm gonna wave my own sort of goal for the magic wand. I would love to see payers in general, not just Medicare and Medicaid and Medicare Advantage, invest and incentivize and cover and pay more for proactive care.
Yeah. That is so spot on. And I'm hearing more, even at the payment share level, more innovative models that are coming out, whether it's value-based care, whatever it is. I think there's becoming enough of a conversation to where people are realizing that money can be saved. And so those companies feel like they have a vested interest in being proactive.
Right.
Yeah, that makes sense.
But unfortunately, it's a little, especially again on the government side, it's a little too slow.
Yeah.
But
yeah. I'm not gonna.
Maybe I'm impatient.
Rightfully so. Rightfully so.
Great. So finally, what advice might you have to listeners? It could be clinicians, it could be older adults. It could be other providers, other PACE programs, technology developers, legislators. You name it.
Yeah, I think for the general listener, I think exercising with intensity. That if you're not doing that now, then to do some research and see what that might look like, and to your point about having fun with it, that is the key. Is just to have fun. It has to be sustainable. I think from a technology standpoint, going back to what you said earlier in terms of how we're using, whether it's Claude or some other tool, figure out what works and what doesn't work. And you only learn it as you use it. And so try it and see what happens. I think from the standpoint of more organizational or even government, I think being open to and learning from the successes that are happening in some of these innovative models like PACE can be super helpful. And approaching it with an open mind and creativity, I think, can go a long way. So
yeah, absolutely.
Yeah,
I totally agree. I would add also the Medicaid waiver program.
Right.
Because again, I've seen examples from Kansas that are I'm really proud that they of the results that they've achieved. Excellent. So finally, where can people, the audience, learn more about Chris, about BlueStem PACE service area? Where would you point them to look?
Sure. BlueStem PACE is based out of McPherson, Kansas. It's part of BlueStem Communities. You can look us up on the internet. I'm on LinkedIn, Chris Deck. I'm a physical therapist, so feel free to find me there. I would love to connect. So, and thank you for platforming both BlueStem and myself.
Absolutely. Thank you. I think people need to know more about people like you and programs like BlueStem PACE. And again, it's been my pleasure and my honor to host you. So thank you so much for all the good work that you're doing.
Well, thank you.
Thank you so much.